Here are a video of some of the knee tests that we're going to use. I was able to get a patient, so this is what we're going to do. The first one that we're going to do is the anterior drawer test. So we're going to have a line of pull and pull on the hamstrings while holding on the femur. So just so the camera can see, it's going to be like right here. While I pull. And we're really checking for instability here or pain. Really, that's something that's really good at letting us know if we have an ACL or a PCL possible injury. The next thing we're going to want to do is the Lachman's test, which can be done on a foam roller. And with the Lachman's test, same thing, we're going to grab right above the tibia there, and then around the tibial tuberosity. Then the other hand is going to grab the right below the femur, just above the head of the condyles. So we're just going to go right here. Modified version thumb can be over here, and we're going to pull. And that's just really going to help us identify if we've had a ACL injury. The next thing that we're going to want to do, and our next knee exam is a prone Lachman's. For this patient specifically, we're not going to do that one, but that would be a great way to check again for an ACL injury and just reconfirm. We don't need to do any PCL checks for this specific patient. That's on Practical One, so we're lucky in that regard. And then that would also mean a Godfrey's test is no longer required. We could do a varus stress test and just apply some varus stress to the lateral collateral ligaments. And following that, we would not need a neurological assessment. We could do a McMurray's test, and we're going to really be checking here for any meniscus damage. So we're going to support the leg, and the thumb and the index finger are going to just kind of pull the foot into an extended position, and the knee. So just if the patient was lying supine, this would come up and push the patient back, and this would be a way to check. Of course, this patient is sitting down. That's what's most comfortable for him. The next thing that we're going to want to do is we can actually do a Thessalys test, and that's another test for meniscal tears. We can have the patient stand on one foot, and then they can actually bend their knee and flex it to about 45 degrees. So, yep, you can do that. And we're going to have you bend your knees slightly on this leg right here, about 20 degrees. Yep, and turn slightly. And that's just checking for any meniscal damage on the knee. And we can do that on both sides, and that's how we would check for that. So that's what the patient